Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Ketamine. Ketamine shows dissociative anesthesia. N-methyl D-aspartate and so ketamine acts on N-methyl D-aspartate. Ketamine is a phencyclidine derivative. Systemic effects of ketamine. Ketamine on central nervous system, it inhibits the cortex and thus results in unconsciousness. Ketamine inhibits the thalamus and thus it is used as strong analgesia or maximum analgesia. Ketamine activates the limbic system resulting in vivid reactions. It increases the intracranial tension. So ketamine is responsible for cataleptic state. In cardiovascular system, ketamine activates the sympathetic system and thus ketamine increases cardiac output. It causes tachycardia by increasing the heart rate and it causes hypertension. Ketamine is directly acting myocardial depressant which is used in denervated heart or catecholamine depletion or in sympathectomy. Respiratory system. Ketamine activates the respiration and increases the secretions. Ketamine increases secretions of salivatory tracheobronchial secretions and thus ketamine will, because of increased secretions, it will predispose to laryngospasm. So we should give, in order to prevent these secretions, we should give pre-medication with glycopyrrolate because glycopyrrolate will inhibit or decrease the secretions. Airway reflexes are preserved. Ketamine is a potent bronchodilator, so it is used for refractory status asthmaticus. Ketamine in the eye increases intraocular pressure. In the GIT, ketamine increases intragastric pressure and in the muscles, ketamine increases muscle tone. Side effects of ketamine. Ketamine is responsible for vivid reactions. Like it causes hallucinations in 40 to 50%. It causes vivid dreaming in 20% of individuals. It can result in emergence delirium in 10 to 30%. For these vivid reactions, the drug of choice is benzodiazepines can be used. Barbiturates and opioids can also be used. Other side effects of ketamine's include increased muscle tone, increased secretions, there will be sympathetic stimulation, there is increased intracranial tension and there is increased intraocular tension and increased intragastric pressure. Contraindications of ketamine. Ketamine is contraindicated in case of head injury. Head injury, there is spontaneous, so it is contraindicated in head injury. Ketamine. Ketamine is absolutely contraindicated if the patient has had head injury and he is spontaneously breathing, then it is absolutely contraindicated. Ketamine can be given if the patient has head injury and he is on controlled ventilation. Ketamine is contraindicated in eye injury because it increases the intraocular pressure. Ketamine is contraindicated in myocardial infarction because it increases the cardiac output, increasing hypertension, and it also causes tachycardia. Ketamine is contraindicated in left to right shunts due to myocardial depressant action and also due to increased cardiac output, increased hypertension. Advantages and uses of ketamine. Ketamine is a sole anesthetic. That is, it causes analgesia and unconsciousness. So ketamine is an intravenous agent which is most near to ideal. Ketamine is the safest intravenous anesthetic. Ketamine is near to complete intravenous anesthetic. Ketamine is an alternate method of induction in children by IM, uh, by intramuscular route. We can also use ketamine as intravenous, oral, or intrathecal route. Ketamine can be used in treatment of pain, especially post-operative pain, in chronic pain like fibromyalgia, and in complex regional pain syndrome. Ketamine can be used. Ketamine is used in opioid tolerance and opioid hyperalgesia. Ketamine is used in the treatment of acute depression. Ketamine is an intravenous agent of choice for shock patients. In shock patients, it activates sympathetic system causing hypertension. Ketamine is an intravenous agent of choice for full stomach because ketamine preserves airway reflexes and thus aspiration is prevented or at least decreased. Ketamine is intravenous agent of choice for acute asthmatics. For active or acute asthmatics, it is agent of choice. But if you were asked what is the intravenous agent of choice for controlled asthmatics, it is propofol. Ketamine is intravenous agent of choice for low cardiac output, that is for constrictive pericarditis, congestive heart failure, and cardiac tamponade. Ketamine is intravenous agent of choice in right to left shunts like tetralogy of Fallot because in right to left shunt there is increased systemic venous resistance, thus increasing the afterload, thus it decreases the right to left shunt. But ketamine is contraindicated in left to right shunts.
Summary about ketamine. Ketamine is a dissociative anesthesia. It is NMDA type. It acts on NMDA receptors. It has phencyclidine derivative. Systemic effects on CNS. It inhibits cortex, thus causing unconsciousness. It inhibits thalamus, thus causing strong analgesia. It activates limbic system, leading to vivid reactions. These vivid reactions are the main side effects of ketamine. And it also increases intracranial pressure, so it is contraindicated in head injury. It is responsible for ketaleptic state also. On CVS, it activates sympathetic system, thus increasing cardiac output, heart rate, and causing tachycardia and hypertension. Because it activates sympathetic system, it is contraindicated in myocardial infarction and left to right shunts. And because it activates sympathetic system, it is the treatment of choice for the shock patients. Then also it is also the treatment of choice for low cardiac output states because it increases cardiac output. Low cardiac output states like constrictive pericarditis, congestive heart failure, and cardiac tamponade, for them ketamine is the treatment of choice. It can cause myocardial depression in mainly denervated heart. In the respiratory system, it activates respiration. It increases the secretions of salivary and tracheobronchial secretions. Thus, it will precipitate the laryngeal spasm. And the treatment of this is mainly by giving glycopyrrolate. We can decrease the salivary and tracheobronchial secretions. It will preserve airway reflexes. Because it preserves airway reflexes, it is the treatment of choice for full stomach patients. And it is also used for refractory status asthmaticals also for treating because it is a bronchodilator. In the eye, it increases intraocular pressure, so it is contraindicated in eye injuries. It increases intragastric pressure also. It increases intragastric pressure. It increases the muscle tone. So the main side effects are same. The vivid reactions, as we have already talked, like hallucinations, vivid dreaming, emergence delirium can be there. These vivid reactions can be treated by benzodiazepines, barbiturates, and opioids. It also increases the muscle tone. It increases secretions. It is sympathetic stimulation, and it increases intraocular pressure, intragastric pressure, and it increases intracranial pressure also. It is contraindicated in head injury mainly due to increased intracranial tension. In spontaneous breathing patients, it is contraindicated, but in controlled ventilation, even in head injury patients, you can use ketamine. It is contraindicated in eye injury due to increased intraocular pressure. In MI, it is contraindicated due to increased cardiac output and increased BP. In left to right shunts, it is contraindicated, and also it is contraindicated in these things. Then advantages are it is an analgesic, so it causes both analgesia and also unconsciousness. So it is intravenous agent, which is almost ideal agent, and it is the safest intravenous venous anesthetic. It is a complete intravenous anesthetic and it can be used as IV route, oral route, or intrathecal route. It is an alternative method of induction for children also. It is used in the treatment of pain also, like post-operative pain, chronic pain, like fibromyalgia, and also it can be used in complex regional syndrome also. Then it causes opioid tolerance. It is used to rescue in opioid tolerance and opioid hyperalgesia. It can be used in acute depression also. It is actually an intravenous agent of choice for shock patients because it increases the sympathetic outflow. It can be used in full stomach patients because it preserves the airway reflexes. It can be used in acute asthmaticus, for controlled asthmaticus, it is used. Propofol is mainly used for controlled asthmaticus. It is the agent of choice for low cardiac outputs uh, constrictive pericarditis, congestive heart failure, and cardiac tamponade. And it is the agent of choice for right to left shunts like tetralogy of Fallot.
Thank you and thank you for watching.